can go ahead and start.
99, 99, 99, 99, 99, 99.
All right, great, great. I found they were both equal. There were no abnormalities there. Now I'm going to percuss your lung field. So again, I will be putting my hand on your chest and just listening to the sounds as I hit my hands to my knuckles, all right?
Okay.
All right, very good. I heard no abnormalities. Everything sounded symmetrical. There were equal sounds. Very good. Now what I'm going to be doing is auscultating your breath sound. So I'm going to take my stethoscope, if that is okay, and I will be placing it in the quadrants like so. I will take the diaphragm and go and follow the intercostal spaces here, here, and work my way down, going side to side. Here and here. Alrighty. Alright. You could just take a deep breath for me. Very good. Now I will be doing what's called auscultating your voice sounds. I'm going to do something called bronchophony, which is you saying E. And I will be listening for your sounds in your chest. I will be wanting to hear E and not A. All right?
Okay.
If I hear A, that means there is an abnormality and that we will have to do a couple more listening tests.
Okay.
You can begin.
E, 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 E.
All right, good job. There were no abnormalities found. I heard E the entire time, so great job. Now I'm going to do your posterior side, which will be almost the same thing. So if you could turn to the side for me. I'm going to just look for symmetry on her posterior side, so I will be doing the same thing as I did anteriorly, and looking just at her side, seeing if there's any abnormality curvatures or any extra breaths or any hunched overness that she's using to help breathe. So, you just breathe normal. Okay. All right, there was no extra use of any muscles. It looked symmetric, so that's very good. Now what I'm going to do, I'm going to palpate your posterior side of your chest, just as I did on your anterior side. So I'll put my hands here. Just feel for any masses, crevice, or any nodules at this time. Okay. I didn't feel anything abnormality-wise, so that's very good. Now I'm going to palpate your thoracic expansion. So what I'm going to have you do is take some deep breaths, and I'm going to take this tape measure and measure out her thoracic expansion. This is going to want to be 2 to 5 centimeters. So I will place my hands about underneath her scapula, just like this, and she will breathe out and in, and I will measure how much it goes out and in. All right, if you could take a deep breath for me. Release. Again. One more time. That was about 3 centimeters, very good. You were in the normal range, which is very good. And I say normal very lightly because everyone has a different normal range, but this is the point where we really want to see these numbers. Now what I'm going to do is called tactile fremitus, what we did on the anterior side. I'm just going to let you say 99 again, and I will be feeling for the vibrations on her posterior side of her chest. Once again, I want to feel symmetric vibrations equal on both sides, nothing abnormal. All right, now if you can just take some deep breath and say 99 for me.
99, 99, 99, 99, 99, 99, 99, 99.
Very good. Symmetrical each way. There were no odd vibrations found. Now I'm going to be percussing your diaphragmatic excursion. Basically, I'm going to do the same thing. I'm going to be hitting my knuckles with my other hand onto your chest to see where your diaphragm is so I can measure how much volume there is. So if you could take a deep breath for me and then let it out and hold. And hold. All right. Now if you could breathe in for me and hold that breath. Okay, hold. Okay. You can release. That was about 5 centimeters, and our normal range again would be about 2 to 5. So, very good. You are definitely in a good range, which means you are healthy with that. And now what I'm going to be doing is, once again, percussing the lung fields. I will be hitting my knuckles again, just to hear if it's resonating or if it's Tiffany. Great. I just percussed all the lung fields and they all were Tiffany, which is very good sound. If they were resonating, that would be about hitting on bone, which would make sort of like a resonant sound. Now I'm just going to auscultate your breath sounds posteriorly, so I will be putting my stethoscope diaphragm onto the lung fields, and it'll go about on her back side, about here, side to side, going in this sort of outward motion. So just keep going outward as I go down, like so. All right. If you could take a deep breath. Go up from the bottom of your shirt. Okay.
Thyroid is normal. And now we're going to check the lymph nodes in a circular motion, noting mobility, tenderness, size, texture. We're going to start with the preauricle, postauricle, occipital, tonsillary, submandibular, submental, superior cervical, deep cervical, posterior cervical, and supraclavicular, which is good. And now we're going to move on to lungs. I'm going to start with a posterior inspection and palpation of the lungs, noting any deformities. I'm also going to check chest expansion at this time. If you could please take a deep breath for me. Good. And then I'm going to also check diaphragmatic excursion with percussion. If you could please take a deep breath for me and hold it, making sure it's between 3 and 5 centimeters. I'm then going to percuss all 7 positions posteriorly, noting any dullness or hyperresonance in a ladder formation. And then I'm going to auscultate all 7 positions in a ladder formation, noting any wheezes, crackles, or rails. Every time I move my stethoscope, can you please take a deep breath through your mouth for me? Good. And then I'm going to inspect and palpate the anterior lungs. Inspection, palpation all 6 positions, noting any dullness or hyperresonance in a ladder formation. Also going to auscultate all 6 positions. Every time I move my stethoscope, can you please breathe through your mouth for me? Noting any crackles, wheezes, or rails. Moving on to cardio, I'm going to do auscultation of all 5 positions. First with my diaphragm, and then I would repeat this with my bell after. I'm going to listen to aortic first, and then pulmonic, as well as herbs, tricuspid, and mitral, noting any murmurs, clicks, rubs, gallops, listening for S1, S2, and S3s. And then if you could please lay down for me. I'm going to inspect the precordium, looking for any lifts or heaves. I'm also going to palpate the precordium, feeling for lifts, heaves, and thrills. For pulmonic, aortic, pulmonic, tricuspid, herbs, and mitral. I'm also going to palpate the carotid pulse at this time. I'm going to do them bilaterally, but one at a time, feeling for any thrills or waves. And then I'm going to auscultate carotid pulses as well, using the bell of my stethoscope. Can you please hold your breath for me? And then repeat, hold your breath. All of this is at 30 degrees. I'm then going to measure the JVP at about 30 degrees. I would dim the lights for this, and I'm going to find the JVP, adjusting the bed as needed. I would use a straight line from the vein to the sternal angle and measure this, and then add 5, making sure it's below 9 for a normal measurement. And then I'm going to measure PMI at this time. I'm going to have you lay on your left side and feel for PMI, which is very large. And moving on to abdominal, I'm going to lay you all the way flat and put a pillow under your knees for comfort. I'm going to first inspect the abdomen, looking for any striae, ecchymosis, symmetry, any scars, and then I'm going to auscultate all 4 quadrants in a clockwise formation, listening for vowel sounds. I'm also going to auscultate with my bell for any bruise. I'm going to do aortic, as well as renal arteries, bilaterally, iliac arteries, bilaterally, femoral arteries, bilaterally. I'm also going to palpate the femoral artery and lymph nodes bilaterally, noting any bruise. I'm then going to percuss all 4 quadrants, noting any tympany or dullness, as well as percuss the liver, starting mid-clavicular line, working my way up just below the umbilicus until I hear dullness, and then from the nipple area down until I hear dullness, making sure it's between 6 and 12 centimeters. I'm also going to percuss the spleen at this time, working my way towards the axillary line until I hear dullness. I should not hear dullness before the axillary line. Perfect. I'm then going to palpate all 4 quadrants of the abdomen, first with a light palpation of one hand, looking for any facial pain or tenderness, and then a deep palpation of both hands, looking for organomegaly or any masses, as well as palpating the spleen. If you could please take a breath in for me. Good, and I'll palpate the kidney while I'm on this side. Good. And then I'm going to feel the liver's edge. If you could please take a breath in for me, and I'll come up, feeling the liver's edge, as well as palpating the kidney on this side. And lastly, we'll check the abdominal reflexes. Good. And then if you could please sit for me. Sit. Sit. Stay. Going to check for CVA tenderness. Let me know if this hurts. No? Good. Moving on to musculoskeletal. I'm going to do an inspection and palpation of the shoulders, the elbows, the hands and wrists, the hips, the knees, ankles and toes, looking for any crepitus, instability, capillary refill. Looks good. Also checking for muscle bulk and tone at this time. And then moving on to range of motion. We're going to have you please extend and flex your wrist. Good. I'm going to have you abduct your fingers and don't let me push them in. Good. Do this bilaterally. And then I'm going to check your opposition of your thumb and finger, especially the thumb, like this. Perfect. And then we're going to also check your strength at this time. I'm going to check your deltoids first. If you can please put your arms up like this for me and don't let me push them down. Good. I'm going to check biceps. I'll have you make this movement and don't let me pull your arms out. Good. And then triceps, push against my hands. Good. And then we're going to do hip flexors, push against my hands. Good. I'm going to do quadriceps. Sit. Sit. I'm going to have you push against my hands, and then hamstrings, I'm going to have you pull against my hands, and then we're going to check dorsi and plantar flexion. Good. And then moving on to pulses, I'm going to do these bilaterally. I'm going to check radial.
Next, I'm going to do what's called a whisper test. So I'm going to have you cover your right ear, and I'm going to whisper 2 words, or a word, and you just tell me what I say.
Apple.
Okay, and the other ear.
Pineapple.
Perfect. All right. I'm going to move on to your nose. So I'm just gonna be looking right up into your nose, and then we'll look at your sinuses. So go ahead and tilt your head back a little bit. Okay, perfect. And then I'm gonna be palpating your sinuses. Let me know if there's any pain. Any pain at all?
Nope.
Okay. All right, I'm gonna move on to your throat. I'm gonna have you stick your tongue out. I'm just gonna look into the back of your throat and say ah. I'm gonna look at your uvula and your tonsils. I'm gonna look at just your teeth. You can stop saying ah. I'm just gonna look at gums. Can you lift up your tongue? Perfect. All right, and then at this time, I would normally check the ab reflex as well. Okay, moving on to neck. So I'm just gonna feel for any swollen lymph nodes at all. I'm gonna check in the front and back of ears. I'm also going to feel under the jaw and under the chin. All right, and then I'm going to have you take a sip of water. I'm just going to lift your throat and make sure there's no difficulty. Perfect. All right, and then I'm going to feel I'm going to feel your thyroid, make sure there's no inflammation, there's no goiter. Okay, I'm going to try and feel for your tonsils, make sure they're not inflamed. Perfect. And then I'm going to have you move your head in various directions. So first up and down, and then side to side, and then touch your ear to your shoulders. Perfect. Any pain at all?
Nope.
Okay. All right, we're going to move on to respiratory. So I am going to have you kind of scoot toward the edge. I'm going to start with your back. I'm going to just palpate your back and your ribs. You just let me know if there's any pain at all. I'm just looking for symmetry. I'm going to compress your ribs. Any pain?
Nope.
Okay. All right. And then I am going to do a few things. So first I'm going to place my palms on your back again and have you say 99. And I'm just...
Okay.
Perfect. All right. Go ahead.
99, 99, 99, 99.
Perfect. Now I'm going to percuss. So I'm just going to do a light tapping and a ladder-like motion. All right, and now I am going to listen. So I'm just going to have you take deep breaths every time you feel my stethoscope. Good. All right, so I'm going to go in those same motions and I'll have you say 99.
99, 99, 99, 99, 99, 99, 99, 99.
All right, now I want you to say a drawn out E.
E, 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 E.
Perfect. And now I want you to whisper 99.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. All right, moving on to your front, I'm gonna place my back of my hands on your front side, and I'm just gonna have you say 99 again.
Okay. 99, 99, 99, 99.
Perfect. Now I'm just gonna listen, so I'm gonna have you take deep breaths again. Perfect. All right. Moving on to your heart. So I am going to check your carotid pulse and look for any distension of your jugular. Okay, I'm just gonna listen over your carotid pulse, make sure there's no bruit. heart sounds when you breathe normally. Okay. Then I'm going to check for circulation, so I'm just going to pinch your fingernails. Perfect. All right, moving on to your belly. I'm going to have you lie down for this part of the assessment. Okay. So normally I would just look at the skin, just make sure nothing is protruding, any lacerations, again, any redness, any weird rashes or anything. I'm going to look for a peristalsis. And can you tell me your last bowel movement?
This morning?
Okay, and I'm going to listen now in all 4 quadrants. All right, I'm gonna auscultate over your abdominal aorta, make sure there are no bruits. And your renal aorta. And then I'd also do the femoral arteries. Now I'm going to percuss. I'm just going to do light tapping again. I'm going to check for liver span and then enlarged spleen. So first I'm just going to tap. Okay, I'm going to check for an enlarged spleen. Or sorry, liver. Okay, I'm going to just eyeball and measure the distance. And then I'm going to check for an enlarged spleen. Can you take a big breath in and hold it? Perfect, and let it out. All right. Okay, now I'm going to do palpation. So I'm going to start with light palpation. Just let me know if there's any pain at all, and then we'll move on to deep, okay?
Okay.
Okay. Alright, and then deep palpation. Again, let me know if there's any discomfort. Alright. And then I would test for any inflammation at all. Again, any protrusions. I'm going to palpate your kidneys. I'm going to place both hands around you. Okay. And then I'm going to palpate the width of your abdominal aorta. I'm just going to feel for the pulse and measure, make sure it's in the correct distance.